Hello, my name is Calvin Boone, and today I'm going to discuss natural environment type specific phobias. You've probably experienced the telltale feeling of stomach churning discomfort while standing on a high ledge, or perhaps you've looked out the window at a looming thunderstorm and felt uneasy. These are likely evolutionary responses to risks in our natural environment, but there are far more severe examples of this that would fit into the DSM-5 definition of natural environment type phobias. The key distinction between the relatively relatable experiences outlined above and those that would classify as phobias come from their concept of rationality. Obviously, having a healthy amount of respect and maybe even a little fear of the dangers of our natural environment was and is crucial to our survival as a species. Having these inherent fears allows us to keep ourselves safe and out of potentially dangerous situations. A phobia, on the other hand, arises from an irrational level of fear of a given condition. The DSM-5 defines this by stating, the fear or anxiety is out of proportion to the actual danger posed by the specific object or situation and to the socio-cultural context. Let's take a deeper look at a socio-cultural perspective on natural environment type phobias. This idea that our fears and phobias are intrinsically linked to our social environment and cultural norms is relatively well accepted and serves as a basis for the discipline of sociology. In a 2003 journal article for Sociology of Health and Wellness, Joyce Davidson and his colleague Mike Smith assert that, quote, biophobias are at least in part a result of modern society's ideological obsession with separating, controlling, ordering, and subjugating an unruly nature through artifice. This idea seems relatively intuitive when you break it down. We, as humans, live in a society where we attempt to dominate and control the natural world and are uncomfortable with the notion that we don't always have that control. The journal article from Davidson and Smith outlines the use of virtual reality as a potential treatment for those suffering from natural environment type phobias. While traditional treatments might include some form of exposure therapy, the added benefit of virtual reality is that the patient can have full control over the phobic trigger. This speaks directly to sociocultural theory asserting that the lack of control of the natural world is a direct cause of the specific phobia. Davidson and Smith reference a 2001 case study from Paul Abellis, quoting him as saying, so from the point of view of the clinician, using the computer program, they have a chance to control their fear, but also perhaps an experience of controlling the thing that they are scared of externally. One potential argument against this form of therapy is that by simulating nature in a technological manner, one might actually reinforce the phobia by further alienating themselves from the natural world. Now we're going to take a look at a behavioral and biological perspective on natural environment type phobias. The behavioral biological approach to specific phobias, natural environment phobias included, is known as prepared classical conditioning. This theory asserts that through evolutionary adaptation, humans have evolved certain fears and phobias associated with items or situations that may cause us harm. While these fears may no longer pose a realistic threat to us on a daily basis, the long-standing connection with danger and risk has instilled an associated fear or phobia that is difficult to reverse. Nolan Hexham, page 122. Another consideration with the behavioral theory is that observational learning may play a role as well. If a parent, for example, displays a significant level of fear of an object or situation, it is likely that the child will in turn experience a similar associated fear. Just like the sociocultural theory for treatment of phobias, exposure therapy seems to be the most widely accepted and used treatment method for natural environment type phobias. The difference here is that behavioral theory relies less on the control element that sociocultural theory hinged on, and instead emphasizes the ideas of conditioning and deconditioning to explain the cause and find a treatment. Behavioral theory treatment falls into three categories for natural environment type phobias: systematic desensitization, modeling, and flooding. Desensitization and modeling are similar in that they both attempt to lessen anxiety through altering the association with a given object or situation from one of fear to one that is increasingly more calm over time. The flooding approach involves high-level exposure to the phobia until the fear begins to diminish. For many natural environment type phobias, desensitization and modeling are easier to employ than the flooding approach because of the nature of the phobia. Comparing and contrasting theories. While I feel like the behavioral theory of natural environment type phobias may be more encompassing, I think the sociocultural approach related to control is far more interesting. As our society increasingly values time spent inside over time spent outside, it makes sense that our fears and anxieties of the natural world are increasing. I think the prepared classical conditioning definition in the behavioral theory is a well-rounded concept that works to include ideas from both the social and behavioral perspectives. From a treatment perspective, I think the traditional forms of exposure therapy, coming from a behavioral viewpoint, are probably more accessible and potentially more effective, depending on the specific phobia. Moral and ethical concerns and solutions. I had a little trouble finding significant moral and ethical problems with this type of specific phobia and specific phobias in general, but the most notable one that I thought of was the potential for cultural beliefs and practices to be misdiagnosed as a phobia. This could certainly be a possibility, and one that would likely disproportionately impact minority communities, whose cultural practices might not be fully understood or represented in the psychological field. The textbook and the DSM-5 differentiate between natural environment type phobias and animal type phobias, but I think there are a lot of overlaps between the two, especially when it comes to the element of control from the sociocultural perspective. In that instance, it could certainly be possible that an individual from a culture that has certain feelings or beliefs about different animals or environment type events may be misdiagnosed or misinterpreted as having a specific phobia. In terms of coming up with a solution for this potential ethical issue, the most significant thing that can be done is ensuring that individuals from all cultures are well represented, or at least understood within the psychological profession. These misdiagnoses can ruin someone's life and severely alter their perception of reality, not to mention the additional risk of alienation when it comes to not understanding the cultural practices that informed the specific belief. As a whole, the field of psychology has come a long way towards individualized treatment and diagnosis, but there is still a long way left to go.